In honor of Breast Cancer Awareness Month, local experts from Sansum and the Ridley-Tree Cancer Center that are now part of Sutter Health shared their thoughts on a Zoom call. Doctors and clinicians from the Sansum Clinic and Ridley-Tree Cancer Center are doing their part to raise breast cancer awareness.
Most physicians recommend annual mammography starting at age 40. So that's every year mammography if you're at average risk.
The other important message I'd like to share is that we diagnose women with breast cancer at an early stage when they do get their mammograms. So I always reinforce when I see patients that their breast cancer is treatable and curable. And that's the important message we want to send to our patient population.
One of the surgeons created the term oncolactation.
And if there's one thing I'd like people to know is that mammograms and MRIs are safe when you are breastfeeding, and mammograms are safe during pregnancy.
A genetic counselor encouraged people to talk to family.
Having those conversations with your family, or then, allow you to talk to your healthcare providers and really aid in potentially early detection and possibly prevention.
Patient navigators are funded by the Cancer Foundation of Santa Barbara.
We come alongside patients and say, how can I help you? Patients with breast cancer get assigned a navigator early on in their course of treatment, and we follow through with patients and their families until survivorship. We just stick alongside and just say, what can we do to make your course easier? You can call me, you can have my direct phone number. We're here for you.
3D mammography helps screen dense breast tissue that may lead to additional tests. The rate of breast cancer in younger women has increased. It's one of the reasons they recommend paying attention to your breasts.
So now we just say general familiarity with your breasts. So if you suddenly have a nipple that is inverted and it wasn't inverted before, or you notice a lump, or you have nipple discharge, that's what they recommend people pay attention to.
They say advances in treatments and new drugs are making a difference. As for prevention, they recommend everything in moderation, especially alcohol.